Hello and welcome to a brand new video on the Baroceptor Reflex. So have you ever wondered why when you stand up suddenly you get lightheaded, a little dizzy? Well, what we're dealing with here is the Baroceptor Reflex. So let's take a look at what's going on, what's happening, and the physiology behind that. So what we're going to be looking at in this video is, first off, what is the homeostatic mechanisms that control my blood pressure? We're going to look at what baroceptors are, where they're located, and how that would relate to blood pressure. And then we're going to look at pressure senses. Where does it go to the brain? And what does the body do with that brain? How does it respond to it, to that information, to either increase or decrease our blood pressure? So let's get an idea, first off, what a baroceptor is. So when we're dealing with the word baroceptor, the word baroceptor tells me a lot about what's going on. Baroceptor. The word baro is referring to pressure. So this is saying we got a pressure sensor. And scepter is a sensor. So we've got a pressure sensor that is going on. That's what we're dealing with here anyway. So let's get an idea of what's going on and how these baroceptors are important and why we're learning about them. So first off, what we got to understand is that your blood pressure is kept very nicely stabilized. Blood pressure normally is about 120 over 80 for normal blood pressure. And this is one thing that we got going on. And the heart rate is somewhere between 70 to 100 beats per minute. So with these kind of values, think of these as homeostatic ranges that the body is trying to keep normalized. A normal blood pressure, a normal heart rate, to think that pressure is heavily influenced by heart rate. We'll look more into this in just a moment. Now, we have two negative feedback loops who are involved in that. And the first one here is, of course, the topic of this video called the baroceptor reflex. And the second one is called the chemoceptor reflex. And these will be two incredibly important visceral reflexes to help control blood pressure going on. Now, baroceptor, of course, being pressure. Chemoceptor is measuring chemicals, such as carbon dioxide, things like that. Now, we'll look at another video on that, but we'll be worrying about carbon dioxide levels later on in another video. So these are negative feedback loops. That means if blood pressure is the stimulus that we're trying to regulate and blood pressure goes up, then the body will respond to lower it, because in a negative feedback, the stimulus and the body's response will always go in an opposite direction. And if the blood pressure were to decrease, then what you would see is the body's response would increase that pressure, because the stimulus and the body's response always go in opposite directions in a negative feedback loop. So like we said, baroceptors are pressure sensors. And we're going to find them in a couple important locations in the body. So I'm going to draw out an aorta here, and assuming here, I'm going to draw a very simplistic version of a couple of arteries here, if I can at least get my pen here on my iPad to cooperate with me. And we're going to see a couple important things happen. First off, what we're looking at here is aorta. We're coming off on some important structures here. Vessels that are going to be supplying the body with blood. And we're going to have some of these baroceptors. So in the aorta, we got a common carotid artery. We've got a carotid sinus, and we have our aortic arch. Now, these are important areas for some of your baroceptors. First off, these baroceptors are going to be located in here. So we have baroceptors located in the aortic arch, special stretch receptors here, and the carotid sinus, and these are going to be our most important ones that we're dealing with here, is in the aortic arch and the carotid sinus. Now, they're also going to be found in the right atrium of the heart. They're going to be found in the rest of the carotid arteries, other parts of aorta, but the aortic arch and the carotid sinus are going to be the most important ones that we need to know about. But they're monitoring stretch. So when they monitor stretch, what they got to be able to do is send information to the nerves that are monitoring these baroceptors. So what's going to happen is I've got a nerve monitoring these baroceptors, and this nerve is going to go to the central nervous system, the CNS, and it's going to use a nerve, cranial nerve, number 10, the vagus. And the vagus nerve is going to be monitoring the baroceptors found here in our aortic arch. Now, for those that are found here in the carotid sinus, we are going to be sending that to the CNS. We're using cranial nerve number 9, the glossopharyngeal. And those information will go to the CNS, central nervous system, specifically the medulla oblongata here, and it's going to help us make sense of what's going on. Now, I'm going to show you how this happens. So to see this, what we're going to do is draw out some blood vessels. And I'm going to draw a blood vessel here. And I'm going to draw out another blood vessel here. And what I'm going to do is take a look at what happens to the blood pressure. So blood pressure, let's say that inside here I've got an increase in blood pressure in this vessel. A high blood pressure. Well, what's happening is if this blood vessel, had baroceptors in it, what is going to occur is there will be a degree of stretch that is going to occur. This extra pressure is going to exert extra force here onto the wall of these blood vessels, the wall of this artery, and it's going to push it outwards, stretching that blood vessel. And when that blood vessel stretches, this baroceptor is going to send information to a neuron. And that's going to send it to the CNS. Now, what it's doing is as I stretch it, the baroceptor is increasingly stimulated. And then it's going to ensure that more action potentials per second is traveling down this neuron. So this increase in blood pressure will increase the amount of action potentials that this neuron sends to the CNS, and it's going to tell me, the CNS, that there's been a change in blood pressure. Remember that if you have a normal blood pressure here is in relation to 120/80, and if this is seen as your normal pressure, if it goes up, the body's baroceptors are going to send a signal to the brain recognizing that that is off, that it is too high. Now, vice versa, if we have the opposite happening here, where in this blood vessel we see a decreased blood pressure, and this blood pressure were to drop inside this blood vessel, then the amount of stretching definitely will decrease, and this blood vessel will not be stretched outwards, and he's going to be more relaxed. And so what's going to occur is when these baroceptors that are located here, they monitor this change, they detect that change, that it's gone down, when they send signals to the CNS that something has changed, that the blood pressure has in fact gone down, then what's going to happen is, how does it do it is the interesting thing about it. It's going to register that there are fewer numbers of action potentials per second. The number of action potentials sent down that neuron is going to be far less, so the CNS is going to register this as a change. If there is a set number of action potentials for normal blood pressure, then an increase in blood pressure increases the action potentials, and a decrease in blood pressure decreases the action potentials. The central nervous system is going to be able to understand that. Now, this leads me to a very important thing to try to grasp, is that if I want to measure pressure, pressure can be handily measured by using an equation of pressure is flow times resistance. If pressure is flow times resistance, the flow is referred to as cardiac output, and resistance is caused by a variety of things: vasoconstriction, blood vessel diameter, as we say, the texture of the blood vessel, viscosity, and a variety of factors influence that. So we can say that blood pressure is heavily influenced by the cardiac output and the resistance. Cardiac output, we know, is heart rate times stroke volume. So that's going to be very important as we go to our next steps to try to see what's going to happen in the body when we do this. So we want to make sure we understand that equation. And so we say that pressure is equal to flow times resistance, and flow is said to be my cardiac output. Well, cardiac output is heart rate times stroke volume. Resistance is all about diameter of the blood vessel. Whether it is smaller or larger is two big major components. There will be a greater amount of resistance if you have a smaller vessel, and a lower amount of resistance in a bigger vessel. So we can see the vasodilation, vasoconstriction, and then the stroke volume and cardiac output. That means heart rate and stroke volume are heavily contributing to cardiac output, and cardiac output is the flow. So that is what we got to keep in mind here to help us understand what's going on. So what I've done is I produced a little schematic drawing to help us try to understand a little what's going on here. So if you want to go ahead and recreate this, just hit the pause on YouTube. Go ahead and draw this out with me, labeling these things, and then come right back to the video, and we're going to explain what's happening here. Alrighty, so what we're going to look at is, let's start off with actually a decrease in blood pressure. Let's say that our body has measured that blood pressure has dropped. Well, the baroceptors, let me write that a little neater, BP. The baroceptors located in the arch of the aorta, aortic arch, and the carotid sinus are going to be able to detect this change in blood pressure. Given that, you're going to have some cranial nerves that these are stimulating, and you're going to take information to the central nervous system the medulla oblongata, where this information is integrated. It goes to an area called the solitary nucleus. And at the solitary nucleus, this information, now remember, carotid sinus, it's cranial nerve number 9. And in the aortic arch, it's cranial nerve number 10, the vagus. And that goes to the solitary nucleus. And the solitary nucleus is going to send information to the vasomotor center. Now, vasomotor center controls blood vessels. And as it goes to a blood vessel, the blood vessel here has a normal resting diameter. Blood pressure is low. And if we remember that pressure is flow times resistance, the resistance here needs to be increased. So we will contract or constrict the blood vessel, making it get smaller. We call that vasoconstriction. And this vasoconstriction will increase the resistance in this blood vessel, and that's going to immediately start to increase the pressure. So we're going to cause vasoconstriction around our body systems. And that's these visceral effectors who are carrying this out. Because remember, any kind of thing, you have a sensor, an integration center, and an effector in every reflex that's going on. And this will ultimately start to lower the blood pressure. Now we have two centers in the brain. Blood pressure is low. We have cardiac acceleratory center and cardiac inhibitory center. Now the cardiac acceleratory center we do not need here. Cardiac acceleratory center is what we need. We do not need the inhibitory center. The cardiac inhibitory center is going to send a signal to the SA node of the heart to increase the heart rate. Also, we're going to go to the AV node of the heart, and that's also going to help increase heart rate. But another thing it does is it goes to the heart muscles, the tissues of the heart, to increase contractility, which this increase in contraction will thereby increase stroke volume. Now, if I've increased stroke volume and I've increased the heart rate, I am increasing the cardiac output. And remember, pressure equals flow or cardiac output times the resistance. That means pressure goes up. The body's response was to raise pressure against the stimulus, a lower pressure. Now, the solitary nucleus is an important clinical region for the brain. Something I want to mention very briefly is damage here, stroke, things like that will cause arrhythmia, and now you can see why. So it's a very important clinical area as it handles most of our visceral senses and involves a lot of information there. All right, so with that one in play, let's look at what happens when we have high pressure. Let's take a look at a high pressure. So let's say in this person, the blood pressure has gone up. So there has been, for some reason, an increased blood pressure. Now, maybe that increase in blood pressure is because I stood up very fast, and then I'm going to get very drowsy. My blood pressure is going to drop suddenly, and I get dizzy. This is orthostatic hypotension. So the orthostatic hypotension that happens, but this increase in blood pressure, our aortic arch detects it, and our carotid sinus detects it. Now, the baroceptor is located there to detect it. Now, why would we put them there? Well, there's a phrase that we oftentimes use where I grew up, that if you want to get good water, you go to the head of the spring. And the head of the spring here, where blood is first coming out of the aorta, this is right there, associated aorta, before it goes places. We can try to adjust it very quickly, very soon after it leaves the heart. So what's going to occur is this information now is going to leave these two areas. Now remember, we're dealing with cranial nerve number 9, monitoring the carotid sinus. And cranial nerve number 10, monitoring the aortic arches, baroceptors. The innervation, the sensory information goes to that solitary nucleus, where he's going to send information to Vasomotor Center. And the Vasomotor Center here is going to carry out some changes. Now, the blood pressure is too high, and we want to lower this pressure. So what Vasomotor Center is going to do is we're going to send this out, and he's going to actively dilate our blood vessels, vasodilation, and that's going to make this hole bigger. And so with vasodilation, we are in fact decreasing the resistance. Now, we don't need cardiac acceleratory center here because our blood pressure is too high. We want to go send information to cardiac acceleratory center here, or cardiac inhibitory center, sorry. And we're going to send that information to the SA node, to the AV node, and to the heart muscle. When we send it to the SA node and the AV node, we're going to decrease the heart rate. Also, we're going to decrease the contraction, which ultimately is going to lead to a decrease in stroke volume. Now, with a decreased heart rate and a decreased stroke volume, we're decreasing cardiac output. And remember, pressure is equal to cardiac output times resistance. The resistance has gone down, cardiac output has gone down, so pressure goes down. So anti-inotropic, we're preventing this contraction from happening. So what this is telling me is these negative feedback loops that are occurring there, where sensory information from the baroceptors are detected, sent to the midbrain, and something is done about it to oppose the stimulus and negative feedback. I really hope you enjoyed this video and found it useful in your studies. Let me know if there's more videos I can do and topics you would like to see me cover. If you ever see anything you don't think is clear enough or would like to see me do better, please feel free to contact me. Put something down in the comments. Let me know what I'm doing good at. Let me know what I'm doing poorly. I want to hear from you so I can make these videos better to help all of you out there. Thank you for watching. Please take time to like, subscribe, comment. Let me know, and just thank you for watching my video. Thank you so much.